Hello everyone. Today we'll be talking about the lessons learned, observed, and lost following the COVID-19 pandemic. So what are some things we learned during the pandemic that can help us be better prepared for future health emergencies? Rapid vaccine development and global collaboration. Innovation and advances in vaccine development paved the way for the COVID-19 vaccine rollout to happen in a timely manner and showed promise in tackling future pandemics. Improved surveillance, testing, and contact tracing. The pandemic strengthened surveillance and testing technologies, a tool which will be useful in surveillance and testing for future pandemics. Digital adaptability. The pandemic showed us that we can shift to virtual platforms for education, work, and healthcare. Strengthening and expanding these digital capabilities can enhance preparedness and help mitigate the challenges associated with future lockdowns or stay-at-home orders. Now let's take a look at some lessons we'll continue to see in future health emergencies and that we should continue to be mindful of, but that may be harder to control. Misinformation. Public health mistrust and social media caused an influx of misinformation related to the pandemic, which led to vaccine avoidance, refusal to wear masks, and the use of alternative medications. Though informational campaigns attempting to debunk these claims were implemented, this is an issue we should expect to see again and aim to be better prepared for. Challenges with communication. As new information was being learned regarding the pandemic, it became harder to effectively communicate to the public, especially when things were constantly changing. In the face of uncertainty, lessons can be learned on how to be even more prepared, transparent, and empathetic. Impact on mental health. Rates of anxiety, depression, post-traumatic stress disorder, and stress increased globally during the pandemic. While mental health challenges are almost inevitable during times of uncertainty and crisis, more must be done to effectively adapt and provide accessible resources and support systems. We should be aiming to ensure individuals are better equipped to cope with future health emergencies and aim to reduce long-term psychological impacts. Economic impact. The COVID-19 pandemic caused widespread economic disruption and placed a heavy burden on the global economy. While all countries were affected to varying degrees, the economic toll was particularly severe in some regions. To be better prepared for future pandemics, policymakers and health administrators need to prioritize the development of effective economic programs. Lessons lost, or issues that often go ignored, which we should be striving to change. Inadequate healthcare infrastructure. The pandemic highlighted issues within health systems, like overburdened physicians and nurses and limited hospital beds and ventilators. While there has been an increase in funding to provide more healthcare resources, it's still not enough. More needs to be done on a global scale to ensure every country has enough healthcare resources to be better prepared for another pandemic. The issue we should be aiming to address is systemic health inequities. Racial and ethnic minorities and individuals with low socioeconomic status were disproportionately affected by the pandemic. Despite this clear evidence, these disparities are often overlooked in health policy and emergency planning. Without meaningful action, these same communities will likely continue to bear the brunt of future public health crises due to lack of structural support and access to adequate resources and care. Well, I hope this presentation brought some light on the lessons learned, observed, and lost from the COVID-19 pandemic. Thank you all for listening.